morning. Today I'm going to talk about new changes in indoor dining protocols. I want to start by thanking all of the restaurant owners and workers who have followed the existing protocols to keep their customers and their employees safe. The pandemic has been harder on the restaurant industry than on most, and it's up to all of us who value a dynamic restaurant scene in St. Louis County to support those local businesses as they weather the COVID storms. As I mentioned last week, the Department of Public Health has been working closely with a core group of restaurant owners on new safety protocols for indoor dining. And because new cases continue to fall in St. Louis County, today I can announce that the Health Department's new protocols will permit indoor dining starting January 4th. The Health Department and the restaurant group have agreed on straightforward guidelines for indoor dining, including 5 key changes. First, occupancy at restaurants will be limited to 25% of their fire code capacity, or the total number of diners sitting at tables 6 feet apart, whichever is lower. Banquet facilities will also be limited in their occupancy to 25%, or 50 people max when providing dining. And second, new mask protocols will be in place to protect restaurant workers better. Third, restaurants and bars will be required to close by 10 p.m. Fourth, some bars will need to install physical barriers like plastic or plexiglass. And fifth, restaurants and bars will record the names and contact information for patrons to assist with contact tracing and case investigation if that proves necessary. There are more details available about these new protocols that will be in the Health Department's new order and guidance documents. Those will be posted later this morning at stlcorona.com. It's important to emphasize that we're able to make this policy change because the numbers are going in the right direction. But it's also important for everyone to realize that indoor dining, even with these protocols, continues to pose substantial risk to patrons and employees alike. We worked carefully to mitigate those risks as much as possible. And I want to thank the restaurant owners who've worked with us, and I want to thank them for their collaboration. Throughout this pandemic, most community members have followed public health guidelines. A few outliers haven't, but most people realize that our public health experts are doing their very best to craft policies that protect us all from this deadly virus. And as I said earlier, I hope we can all join in supporting our local restaurants as they try to survive the pandemic in a way that is safe for their customers and for their workers. We will continue to make decisions regarding public health protocols based on the advice of the Pandemic Task Force, the CDC, and the St. Louis County Public Health Department. They all will be watching hospital admissions, ICU capacity, and all of the hospital data, along with new cases, trends in testing, availability, and positivity, and vaccine availability and administration. You can continue to follow all of our data at stlcorona.com. Let's start 2021 safely so we can continue to rebuild our economy and keep our loved ones healthy. And I'd be glad to answer any questions.
Here's a question, Dr. Page. What has the county done and what can it do financially to help restaurants and other small businesses?
Well, to date, the county has used $24 million of CARES funding to help restaurants and other small businesses through grants and other programs. In addition, we've learned that the new stimulus bill that's been passed by Congress provides an extension of unemployment to restaurant workers and everyone else who's been affected negatively by the pandemic, and also extends PPP funding for restaurants and other businesses. I don't think it goes far enough to help our restaurants, but it's a start, and that conversation will continue at the federal level. And should new federal CARES money become available in St. Louis County, we'll certainly look at how we can help our affected businesses as well.
All right, this one comes from St. Louis Public Radio. What are the criteria for tightening restaurant restrictions? assuming that we see a predicted post-holiday spike in infections?
Well, we'll be watching new research surrounding the transmission of COVID in indoor dining. We'll be watching research around medical care that's provided to folks that have been infected with COVID. And we'll be watching all the same markers that we've always watched: hospital admissions, ICU admissions, ventilator availability, and trends in hospital admissions, along with testing, positivity of testing, trends in new cases, and now a new variable that we're excited to have the ability to watch, and that's vaccine availability and vaccine administration.
Yeah, one more. This one's from KMOV. It does have to do with vaccines. What is the reason for the slowdown by the federal government with the vaccine? Missouri seems to still be short approximately 400,000 shots.
Yeah, it seems that the deployment of vaccines nationally, and then as that spreads down to the states through the state, has been a real challenge. We're doing something in government and in our country that we've never done before, and that's ship a new product, a vaccine, to everywhere that it needs to go. We are ready here in St. Louis County to administer the vaccine. The hospitals are up and ready to go in that administration. I know our pharmacy chains are prepared and have started administering the vaccine to our skilled nursing facilities. We just need to get the vaccine moving quicker down those logistical pathways and down those shipment pathways. Okay, thank you.